My name is Noel Tolbeck. I serve as the Chief Executive Officer for Crescent Care in New Orleans, Louisiana. The Ryan White CARES Act funding has enabled us to continue to provide services for people living with HIV, but also making sure that we are able to deliver services in maybe a not so traditional fashion. But this pandemic is causing us to rethink that maybe there's a better way to do it where we can get those same results of culturally humble and high quality care, but that might be a little bit more convenient for our constituents. Some of the lessons that at least I've learned has been to really turn to our frontline staff, the people that are working directly with the individuals that we are serving, and rely on their ingenuity and creativity and the incredible imagination that people have been able to utilize in figuring out how can we do these systems better and how can we make services more available to people that we're working with.
My name is Mark Baker. I am the Chief Operations Officer for Lifelong AIDS Alliance. The additional CARES Act funding has helped us tremendously in being able to continue providing services to our clients across all of our programs. We were able to deploy all of our staff to work from home and immediately begin providing telehealth services. And in a number of cases, we're getting reports from our team that they are engaging with clients at a much more frequent level, and some of them much more intensely. Additionally, we've been able to use the CARES Act fund to send personal protective equipment that includes face masks, gloves, hand sanitizer, thermometers so they can monitor their temperature to help our clients protect themselves from the spread of the disease. We've also been able to launch a client financial assistance program through those funds. We're changing our medical transportation and focusing more on taxi vouchers to avoid public transportation. So we're really trying to leverage our funds that we have in every possible way to help clients stay home and stay safe. So the lessons learned for us have been, we can do this, we just need to be flexible, and we need to be mindful of the trauma that our community is experiencing.
I am Jeffrey Morris, and I work with the Illinois Department of Public Health. I am the administrator of the Ryan White Part B program. CARES Act money allowed us to assist security and safety around housing, transportation to medical facilities. For some of our clients that were tested positive for COVID and then were quarantined at home, we used that funding to help network food delivery. HRSA was wonderful in opening up that avenue to many of the Part Bs and actually statewide in the other parts. I have to say I was very proud of our HRSA national partner that helped us at the state level navigate what could have been a challenging process that we didn't have initially planned out in the early stages of the pandemic.
My name is Dr. David Rosenthal. I'm the medical director for the Center for Young Adult, Adolescent, and Pediatric HIV at Northwell Health in New Hyde Park, New York, and I'm a recipient of Ryan White Part D funding. So the Ryan White HIV CARES Act program has really provided outstanding resources for our program. During the COVID-19 pandemic, we were able to create regular conference calls and regular Zoom meetings where we're able to interact with our team members, where we get together more frequently than we would in person as an entire staff to talk about the needs of our patients, to talk about what worked, to talk about what new ways we're able to use to engage patients and have patients receive the kinds of care that they needed to receive. So COVID-19 taught us many, many lessons. I think the most important lesson is to be flexible and to make sure that we can always look forward. What worked yesterday will not necessarily work tomorrow. And so what we need to do is we need to innovate at every single opportunity. We need to be able to be creative and be able to come up with new ways to reach our patients and to be able to communicate with our staff and team members.